March we are again coming live. Ethar we will try to get a delegation from Dubai. जोटा कि फाइनल हो गलानी 31 डॉक्टर्स से माने मार्च एंड रे आछुंती हमको 2 दिन देते हमें ता देरे we will try to 30 जन पैनलिस्ट रे सब तक दुबई रो प्रैक्टिसिंग डॉक्टर्स ऑफ ऑल डिपार्टमेंट्स गोटे पूरा हॉस्पिटल चेन रे आसीबो ता सहित हमर चेष्टा करिया 300 की 400 फिजियो को ता देरे ऐड करबा किछि नो रजिस्ट्रेशन नथिंग माने चार्जेस समस्ते सम्मान पाइबे पूरा एमते फ्लाइट रे जानती पूरा मु चाहूची से गुडा टिके हम चेष्टा करिया या पर थोर आउरी बेटर करिया जहार जहा सरीबो रेस हैंड करिवो तंबको सर्विस आसीबो जहार भी किछि माने दरकार खाइबा रे एक्स्ट्रा हाथ रेस करले से आसी सर्विस दे देबे ओके एमती नो जे सेटिक रे ही कंप्लीट मोर टिके गोटे छोटो काली रात रे सोई नथिल जमा टिके गोटे 10-15 मिनट पावर नैप नै गेली ना ओके तो जो आउ कौशिक सर आसी पहुंचले दैट इज वेरी मच लकी कौशिक सर को प्रोफाइल समस्त मन रखता से होचंदी बीसीसीआई रो क्रिकेट टीम रो ए टीम रो 12 वर्ष पई फिजियो थिले वेरी टैलेंटेड पर्सन एठी बसचंदी किंतु केही टिके एबे जाय ताकर कोन कोंदी कोइनूर सबडे स्प्रेड हेनी मु एना टिके जड़ाई दे आउ बेसिकली आईएपी रो जदि आमे देखिबा बाहर हां से आईएपी रो वेस्ट बेंगल रो वाइस प्रेसिडेंट अछंती आमर ये प्रोग्राम को मो पई तो सी सेंटर रिप्रेजेंटेशन बोली मु धरिक चलिबे मते भरबाली कहते लेखा पढ़ा किसी नहीं कि स्टिल सेंटर जदि भी आम प्रोग्राम को नजर रखुची सर को थ्रू सर हाउ इज द फूड सर भालो थैंक यू ओके प्लीज एंजॉय योर फूड खाइबा केमती कोन हेची कहबो नेक्स्ट टाइम आउरी आठू बेटर करिवा सर्विस आउरी आठू बेटर करिवा क्राउड आउरी बढ़िबे थैंक यू एंजॉय करो
सर सटी देखंदो
This session will be very much beneficial for us as well as for the public to know about the cardiac diseases and related surgeries and medical treatment along with the rehabilitation. So first of all, I want to ask Dr. Divyanjan sir that what are the major reasons for the rise in number of heart attacks and how one could self-screen if they are prone to get a heart attack, sir?
So, a warm good afternoon to all of you and I am deeply regarded and I feel very much privileged that I was given one of the opportunity to speak on heart health. You know that today the heart problems are increasing. So day by day, previously usually the heart attacks are usually happening at the age of more than 65, 70 or something, or even elderly people. But nowadays we are seeing very young people, even people at the age of 25. I have recently two patients, one is 26-year-old, another is just 22-year-old. They have heart attack, massive heart attack. And luckily they survived by immediate intervention. But many of them, this is maybe iceberg on the tip of the iceberg. So many of them are there, those who cannot reach hospital at the time and they could have died. We don't know, that data is still missing. But first of all, we have to understand what is heart attack. Am I audible to the last page? Is it audible, please? Yeah. So the question is, what is heart attack? Then only you can raise it why, what are the causes and why it is increasing very fast. So you know our heart is a pump. It is made up of pure muscle. There is no bone, only muscle. So it is another branch of maybe a physiotherapy, but in a higher sense. So it is a pure muscle. It is a muscle physiology, nothing else. It is a pure muscle. So and it is a pump. Other muscles are doing contraction and those, but here it is a closed chamber. This muscle, the uniqueness is it is a closed chamber, in between some hollowness, so it is a pump. It works like a pump. There are 4 chambers. All of you know? There are 4 chambers. Okay. So if the heart stops beating, you know from when the heart started its beating? Any idea? कब से हार्ट बीट करना शुरू करता है? From mother's womb, do you know? And heart is the only organ, the first organ to start functioning. When a mother is pregnant and the radiologist will see that its heart is doing beating or not, then only will say that yes, you have a live baby. If the heart is beating stops, then baby is dead. So it is the first organ to start its functioning, so that in the fetal stage itself it gives blood to all other organs. And it will remain with you till your death. You know, if heart is died, then gone. What will happen? The blood will remain, but it will not be circulated. So, and then what is heart attack? You know, heart also gets its nutrients or blood. It also needs, otherwise it will stop. So there are some arteries in the heart itself, above the heart itself. So they supply blood and oxygen to the heart. If there is some blockage or there is the narrowing of the path, that blood vessel, then that particular area of the heart, that muscles will not get the blood, adequate blood supply. Suppose it suddenly blocks, then that person will die. It will remain alive till maximum till 20 minutes. That is the golden period, actual. Otherwise, if within that period it is not opened up, then that muscle will die forever. And heart, that muscle is irreversible. Once it dies forever. Some dies, some every level, be it professional stress, be it family stress, be it any psychological. Sorry. So these are the 5 most important things which are newer. It was not there previously. This lifestyle. So that's why our young generation are in a corporate trap. They go to the office by 10 am, they wake up late because they slept late night. They wake up late 9 am. They rush to their office without their breakfast. Then in the office they will order some pizza, Zomato or whatever. In the evening they come late in the night and again they will watch their mobiles and again sleep by very late night. And for stress relief they will consume drugs, alcohol and smoking. So this is a whole cycle, vicious cycle of corporate trap. For that reason only, nowadays you see that we are encountering so much of young persons getting heart attack. Thank you.
Preventive measures for the sudden cardiac death, sir. What are the preventive measures for the sudden cardiac death?
One is smoking. Because your in the blood vessel there is endothelium, you know.
Sir.
Once the endothelium ruptures, then only the clot will form. Suppose some patient they have multiple blockages, even sir will know, but they don't have heart attack. They can have angina, they can have anginal pains, but that is not heart attack. They can survive to 100 years if they maintain themselves. So what will cause the sudden rupture of the that plex, that is known as vulnerable plex, sudden rupture. So one is smoking. Second is stress, intense stress or intense exercise. Sometimes you know there is news coming, many people are doing exercise in the gym and they die. So there are two things playing. One is their lifestyle, which is already they having blockages in the heart, but not complete blockages, but that blockages they have a thin cap. And due to some excessive exercise, and simultaneously at that time they are hearing some music which is very intoxicating. They are in front of them the image of Salman Khan or something which have a very big body build, whatever, and carrier stress. So that if I do this bodybuilding, I will go for this opportunity. So all this stress also simultaneously going into their mind. In between they are doing intensive exercise, which is their body is not trained, and other things. So that's why they are getting sudden heart attack. So to prevent sudden heart attack, you have to that 5 A's I am telling, that you have to prevent that. So you should not have take any stress. Up to certain level stress, or I will not call stress, it may be a physiological pressure. It is a pressure in your mind, but stress is how your mind can react to it. Suppose there are pressures. Pressure is there for everybody, but that doesn't mean that everybody will take the same amount of tension or same amount of stress in their mind. So stress is equivalent to pressure by resilience. You know this formula by WHO? Stress is equal to pressure divided by resilience. Pressure is external thing, stress is internal thing. And that resilience power is your inner power. How much you tolerate it. So day by day our intolerance, our tolerance power is coming down. We are becoming more reactive. So that's why we are impulsive, more arrogant, more impulsive. So that's why the young generation are more, they are watching all the video games or they are playing the video games which are more intoxicating, no arrogant behavior. So that's all. So whole the society is going towards that direction. So we have to calm down our mind. We have to take the stress level up to certain level, not more than that. We have to restrict our mobile phone usage. We have to go have a good sleep, at least 6 hours of good sleep, sound sleep, deep sleep. That is very much essential. And simultaneously at least exercise for 30 minutes. Just there is a study that if you walk for 30 minutes a day, just only walking, that is brisk walking, 30 minutes per day, your longevity will increase by 10 years. There are studies. Just by walking. And your lifestyle. Don't consume all these fast foods. You know, fast foods, they will cause you fast heart attack. So fast foods, fast heart attack. Very fast. People are dying at 40, 39 every day. Some newspaper, Facebook, wherever you open, young people are dying. And preventive measures is check your blood pressure at least weekly once. Check your sugar level at least 3 monthly once. Check your cholesterol level, LDL level at least 6 monthly once. And annually do ECG, echo and a treadmill test. You know a treadmill test, stress test is there. So if all these screening tests are negative and you are having a good lifestyle and if possible do some breathing exercise and pranayama and meditation for at least 5 to 10 minutes, that is also very good. Then these are the measures that so that you can avoid cardiac disease as well as sudden cardiac death. So, thank you.
And once I attended a workshop on Sudarshan Kriya. There, the trainer he told that better to be responsive rather than be reactive. So you have to be more responsive. You should not be more reactive for your well-being. So I would like to ask Monalisa Madam that what is the role of physiotherapy in the management of heart failure, Madam?
um, uh, he's in the hospital itself. From there, we start from the monitored ambulation, low-level exercise testing, and then based on that, when the patient is discharged, we plan exercise protocol for them, and this is based on graded exercise level, we can tell. Because each movement has its oxygen consumption, and if you know the Fick's equation, we have stroke volume, cardiac output into oxygen content of the arterial blood and venous blood. That is the Fick's equation. So first part corresponds to the heart, and next part corresponds to the lungs, you can tell, ventilation. And mostly the demand of any activity, we can tell it exercise load, or you can tell any activity has a demand for this oxygen, and cardiac output limits it. So if a person is already suffering from any of the heart condition, or has undergone any surgery, heart surgery, for example, you can see a busy, so they need a graded exercise program after they are discharged from the hospital. Till 3 months of time, we use around 40 to 60% of the reserve, heart rate reserve, and give various aerobic training as well as even resistance training as per the requirements. It is individually tailored always, and some flexibility training also, so that he can go back to his work, or some modification can be done, and he can be go to community easily. That's what we plan for.
Thank you, Madam. That what are the advanced techniques for the treatment of MI? Kindly elaborate the treatment of MI, myocardial infarction.
Thank you for the invitation. Like any heart attack, happens, as Dr. Dibya already has enumerated, there are multiple causes. But once that happens, it depends on at what stage patient reaches the hospital. So whether it is an acute MI, and if it is an acute MI, whether angioplasty can be done, primary angioplasty, which is done then and there. So the aim of primary angioplasty, he will know better, but I'll just tell in a nutshell. Like, suppose there is a culprit vessel, they'll see in the ECG, and then they will do the angio and find out whether there is a culprit vessel. So if there are multiple blocks, patient is not stable and having severe pain, at that point of time, whichever vessel is contributing to that pain or that area is affected, that will be taken care of, and the other things will be left alone. But beyond that, suppose cardiologists deal with it, and then they find out, suppose somebody is having with a ventricular septal rupture, that is kind of emergency which surgeon attends, because it is difficult to put a device there. Other than that, standard treatment is like coronary artery bypass grafting for surgeons and angioplasty for cardiologists. If you take advanced, then it comes to like laparoscopy in general surgery. So minimally invasive cardiac surgery is coming up in a big way, as well as robotic assisted cardiac surgery.
Thank you, sir.
And those
Yes,
things people are telling that you do that, no? That will prevent.
Walking, cycling, mostly walking, cycling, and treadmill walking. These are given. Swimming is a very nice thing, nice form of exercise if we can do it, and little bit walking and then jogging. Combination of these can be done.
Okay. So what we learn that once the heart is a muscle, I am telling. Suppose the patient get heart attack. I have seen many elderly patients getting massive heart attack. They are coming alive after 12 hours. But same time, A 30-year-old male with massive heart attack within 12 hours will come broad dead. So the same duration of time, 12 hours, same kind of heart attack in LED, mid LED suppose, a elderly person coming alive, no problem. So mild pain now reduced. But same problem, same LED is blocked in a middle-aged or a young person coming with heart, coming with massive jeopardy even death or severe heart failure. The reason being is, in an elderly person, because of so much of physical stress, there's old generation people, their hearts, they must have more collaterals already developed, or the capillary density is more. But for younger persons, like nowadays, they are doing work from what is that? Work from home, jobless, hopeless, whatever.
Desk job holders.
Exactly.
That will
Sedentary
be
lifestyle.
Yeah.
Their capillary density in the heart is very low. So they will not, their heart is not ready to take that pressure. Once that artery is blocked, suppose the main road to the Puri is blocked. Suppose now the Puri highway is blocked. So we will go through the gullies, no? That gullies are your collaterals. Those areas which are more number of gullies, the traffic congestion will be less. Suppose the main road is blocked. If the area is only connection route is the main road and the other gullies are not there, then they will suffer. So similarly, by doing regular exercise and core muscle exercise and breathing exercise, I think your tolerance power of your heart or ischemic capability of your heart, that pre-ischemic conditioning, there is something called pre-ischemic conditioning. You regularly put your heart to that level so that it will feel some kind of ischemia. You condition your ischemia will happen, then the heart will withstand. It will never die. Like 1999 super cyclone, we are not conditioned. It is massive destruction. But now 2024, any cyclone will come. We are already conditioned. Our government has taken ample of action so that no zero casualties. So that is exactly by doing regular exercise, by doing regular breathing exercise and pranayama and meditation, you are conditioning your heart so that any amount you will get a massive heart attack, you will not suffer.
Sir, before couple of months I went through an article that is the effect of soleus pump exercise. So in that soleus pump exercise, the
Please give hands for the Bharanjay sir. A round of applause for Mona ma'am. Ma'am, an associate professor at High-Tech Medical College and Hospitals, having 15 plus years of academic experience.
देखो हलचल होने धीरे धीरे दादा
Difficult for all the ladies out here, not only just as a homemaker but also as a woman. Journey will begin. Her maternity experience can have a positive and negative effect on her emotional well-being and health, not only immediately but also for a longer period. So care in
Basically, like you said, motherhood is a completely different phenomena, a very special time for a female. So when we are talking about care for a pregnant lady, it encompasses many things actually. First of all, as soon as she has to be detected, all her tests have to be done. Basically, like we are talking about comprehensive care, then whether she is already having some pre-diseases or not, whether she is having thyroid, whether she is diabetic, whether she is hypertensive or normal healthy. Now, this is a gathering of physiotherapists, so I know it would be more about what would the role of a gynecologist and a physiotherapy would be teaming up. A lot of physical changes also will start taking place. In this case, there is a big role of exercises or physiotherapy. So exercises or a guided physiotherapy means that now she has to go into all these exercises immediately. First of all is like pregnancy is fine or not, because if she say that after the 3 months of pregnancy she should be starting exercises under supervision. And if we are talking about having 150 minutes of moderate activity exercises in a week, that can be, if somebody has been routinely doing exercises, she can do it daily 30 minutes, or can be broken up into 10 minutes of 3 parts in a day, and that is what she ideally needs to be done. It should not be that she is exercising parts and that. So this comprehensive thing has to be made. The patient has to understand and
is present now. And the benefit is honored to welcome a doctor who has dedicated an area to the health and well-being of women. A gynecologist who has been a guiding light for countless women, providing care across all. What are the benefits of regular exercise during pregnancy and what type of exercises are safe?
what is the benefit of regular exercises? Most of the maximum family says there is a myth, even if when a lady conceives, don't do the exercise that will lead to the miscarriage. No, it's a myth. Regular exercise can also maintain the health, can also maintain to deliver a healthy child. And the regular exercise, it puts a very positive impact on your cardiovascular and with psychological state. And when we are advising some regular exercise for a lady, we have to follow some guidelines, we have to follow some principles, which is some exercises which are not needed for the lady. So, as a physiotherapist, I would like to say the exercises should be in the slow and rhythmical manner. And before exercises, you can go for the assessment, you can go for the vitals, check the vitals. After that, if the vital is stable, then you can go for the regular exercise. Okay.
A woman should make when planning for a pregnancy. As we know, in pregnancy, all women should increase weight and how it varies from different women and what are the key nutrients the pregnant women must focus on and should supplement always be taken.
As we know, when a woman is getting pregnant, basically I'll start with the nutrition first. So obviously she needs the proper nutrition, balanced nutrition, which which has to be balanced in carbohydrate, protein, and fat and everything. But she has to focus on the protein most. Every meal has to be some vegetables, some fruits, some protein, and I normally prefer not to excess the carbohydrate intake, but obviously everything has to be maintained. And as man was saying, daily 150 minutes of sorry, half an hour. Very beneficial for her health so that the body remains fit and it prepares the body for the later on stage of the pregnancy she will be facing afterwards. And if one more thing is nowadays women along with the boys, women are also having some of the habits of having smoking and drinking and other habits. This all also has to be stopped when she gets to know she is pregnant. And along with that, if she is a athlete, if she is working for a long time because of her job or something like that, then also she has to have little bit of rest in between. Definitely when she will get pregnant, she has to gain certain amount of weight, nearly around 10 to 11 kgs by the 40th week of her pregnancy. And if she doesn't gain also, then also it will be very harmful for the baby, because like she might land on in having low birth weight baby or some low birth weight baby. So basically she can manage it with her dietary habits, having proper amount of protein and vitamins and other requirements in the diet, so that whatever the weight she will be gaining, it will be balanced, and she can she can lose the weight when she will be delivering. Obviously the baby weights, whatever the baby weight will be, it will be reduced after the delivery. Whatever the Likert volume, whatever the placenta volume, after that whatever will be remaining, she can lose weight afterwards by exercises and maintaining her diet.
It's all about if the lady is increasing, not
She
increasing.
will increase, definitely she will increase when she is getting pregnant.
Yes, ma'am. If she is increasing much, the weight is increasing much, then what should she do?
Basically, we cannot advise the patient to lose weight when she is gaining weight during her pregnant time. But yes, we have to focus on if she is developing any diabetes during pregnancy, any hypertension. So we just have to rule out if the excessive weight gain is because of diabetes or hypertension she is developing because of pregnancy. If there is no any other problems she is developing during that period, then we cannot just advise the patient ki okay, you should not have food, you should cut down or some your food so that you will lose your food. And if there is a certain weight we normally advise the patient to gain, that is like around 10 to 12 kg in her pregnancy. But that doesn't mean ki if a patient is gaining 15 kg or 16 kg, then we have to assure her diet.
Thank you, ma'am. Or having any incontinence and any activities which is indulged which may put more pressure on the pelvic floor muscle, and we can use a pelvic floor organ prolapse questionnaire quantification scale to know the severity of prolapse. And there are some tests like cuff test and Valseva maneuver test to know the stress urinary incontinence. And coming to the treatment part, we focus on strengthening the pelvic floor muscles by giving a strengthening exercises to the pelvic floor muscles by Kegels exercise, or increasing the resistance by using vaginal folds, and lifestyle modification like dietary habits, and to avoid constipation, which may lead to further complication to the pelvic floor muscles. And we can advise for pessary for stress urinary incontinence case. Thank you. Now my question is for Dr. Harshit Kaur ma'am. What is the risk factor for cervical cancer?
If it's a very early menarche, a late menopause, multiple sexual partners if somebody is having, even those who are having a history of smoking, so they all come under a high risk category for developing cervical cancer. Then luckily there is no such genetic correlation of hereditary correlation for cervical cancer. But the best part about this is that it can be detected in a very early stage, and there are also prevention modalities. So detection is by a pap smear, which is a very simple test with all females once they are sexually active. Like if we go for international guidelines, every female after 20 years should get a pap smear done every 3 years. But in case of Indian scenario, we advise once a girl is married, then at least she should get a pap smear every 3 years. And when we are talking about prevention, the most important, and there was a lot of hype because a model who just was declared dead, and the next day we came to know that she's alive, and she just wanted to create a awareness for cervical cancer vaccine. So this is a very good vaccine which is there since the last maybe 15 years. And but the sad part is that acceptance is a little less in India, but now the awareness has become more. So why the cervical cancer vaccine is a vaccine against a human papilloma virus. Like after COVID, everybody is aware of the virus and the antibodies and the role of vaccine. So similarly, this HPV or human papilloma virus is a virus which a female can get infected with after like sexual intercourse, that is the time. And after exposure to this virus, she may develop the disease maybe after 15-20 years. So there's a long incubation period. And all the viruses strains do not cause the cancer. There are particular strains which are responsible for causing cervical cancer. So in this prospect, if the cervical cancer vaccine has come, or the HPV vaccine, which is based that it is causing antibodies against human papilloma virus, and it can be given to a girl as young as 9 years. And that a female can take it from any age from 9 years to 40 years, and it has 3 doses which has to be taken, which is 0 to 6, that is first dose, then 2 months later second dose, and 6 months later the third dose. And it gives a very good protection rate of around 85 to 90% as early in life it is taken. But gradually, if somebody has already given birth to children and taking late in life, maybe around the age of 35-40, then the protection efficacy would be less, because already there could be some amount kind of infections. And this particular vaccine which is available is against the main carcinogenic viruses, that is 16, 18, 31, 32. So it was earlier coming under the name of Gardasil, which was only against the 4 strains. But now the new vaccine which is come against 9 strains, which also includes those strains of human papilloma virus which are also responsible for causing genital warts. So this vaccine is also being advocated for male children. So any male child after the age of 9 also can take this HPV vaccine. So we better call it HPV vaccine and not a cervical cancer vaccine. Why I am talking in detail is because we are part of a medical sector. You all are also part of the medical sector, and you can also now encourage girls and ladies to take this vaccine, which has 3 doses, no side effects, and as young, as early in life, after the age of 9 also any female can take it. Later in life it is a dilemma whether to take or not, because if somebody is taking at the age of 40, she'll get a surety that I have taken the vaccine, I will not get cervical cancer, and then the screening part will get missed. So somebody, if after the age of 35 or nearing 40 asks for the vaccine, we should ideally say yes, you can take the vaccine because we give some amount of protection. But it is still necessary to go for a pap smear test every 3 years or a HPV vaginal smear test that can be done once in 5 years. So in spite of taking the vaccine, the screening part should not be missed for those age groups. But for young age groups, it's definitely a must, and also for males to prevent against genital warts.
Upper limb or lower extremity mobility exercises with mild intensity exercises should be done. And after postnatal care, first we should consult to the doctor, then after go for the exercise. During the postnatal period, first we should go for the core strengthening exercises, isometric abdominal exercises, then go for the strengthening exercises.
Because of the fast foods outside, eating very frequently outside in the restaurants and everything, getting more exposed to gaining weight, too much of weight gain. So in excess of weight gain, there is more of androgen synthesis, so that there will be more of hormonal changes in the body, where androgen excess will be there, testosterone levels increases, there will be they will be prone for diabetes. So this all in combination, they changes so many things in the body. Few things can be diagnosed by blood tests like hormonal levels like testosterone, androgens, and diabetes and everything and all. And along with that, few things we can diagnose it through ultrasound, which is from both of the ovaries, the picture of the ovaries, where multiple small follicles will be around in the periphery of the ovary, bilateral ovary. So basically, PCOD is divided in two things, two different types. One is PCOS and one is PCOD. One is polycystic ovarian syndrome and other one is polycystic ovarian disease. Polycystic ovarian syndrome is a combination of all the things. Like there will be the hormonal changes, there will be the ultrasound picture change, and the patient will be having different symptoms. Like like physical examination also, you can find out few things like you'll be having acanthosis, you'll be having weight gains, you'll be having hirsutism, hairs over the hair over the arms and legs and abdomen, and androgenic distribution of hair specifically. So like mostly if a patient comes with cycle irregularities, by seeing the patient itself, we can just assume if she might be having PCOD or not. So if she is having excessive, as per her age, if she is overweight, if she is having acanthosis, if she is having hirsutism, and along with that she is having cycle irregularities, we can just advise her to do a ultrasound and few blood tests. So depending upon all these parameters, we can just tell like she is having PCOD or not. And mostly everybody says if only she is getting weight.
कितना है? हाँ मुझे जानी चाहिए कितने भी आज्ञा ही वाला पेमेंट अभी कन्फर्म हो जाए देखिए आया
notes also included. Medicines are mostly required, and in this case, exercises though sometimes with too much of exercise, the BP might also go high. So that is we have to monitor. She can be a breathing exercise basic about exercise and about health.
वीडियो टिके टिके दरकार वीडियो वाला मांगुଛନ୍ତି किसे वीडियो देले से जो ये
आखि बंद हेले से ग्रुप फोटो सर कैमरा
Dr. Biswajit Sahu sir for his outstanding contribution to the society by donating all the organs of his son. We proudly declare him the bravest among the braves. We, the Physios, are mourning and as well as celebrating the beloved Dr. Biswajit Sahu sir.
सर कैमरा लुक
मो कहबार उद्देश्य है ये इनफर्मेशनटा जिते अधिकार अधिक फिजियोथेरापी पहुँची था भल ही था जहाँ बहुत सर्ट टाइम भितर ऑर्गेनाइज करा जो प्रोग्राम से ऑर्गेनाइजर मान को बहुत बहुत धन्यवाद मुझे सका कही से प्रति वर्ष वर्ल्ड फिजियोथेरापी डे रे भी बहुत बढ़िया प्रोग्राम हॉस्पिटल करती यहाँ गोटे आउ गोटे एडिशनल मेडिकल फिजियोथेरापी एजुकेशन प्रोग्राम तो एमती अधिक प्रोग्राम अरेंज हो आमर फिजियोथेरापी मान जो नॉलेज रही रिफ्रेश हवा दरकार आम कौन करें आमर फिजियोथेरापी मध्यम कौन करें इनफर्मेशन भी मेडिकल फैटर्निटी पाखे पहुँचवा दरकार जहाँफल कि इन कोऑर्डिनेशन विथ द मेडिकल फैटर्निटी वी कैन वर्क टुगेदर फॉर द बेटरमेंट ऑफ द सोसाइटी. Once again, I thank the organizer for arranging such kind of program. Thank you very much.
It's a great pride for our fraternity to honor Dr. P.P. Mahanti sir. Like ma'am for her presence here. Thank you ma'am.
नाम दीजिए बा
All the delegates are requested to appear at EHS Ganjam Barampur. May I have on stage Dr. Subhranshu Mahapatra?
सर कैमरा
Dr. Subhranshu Mahapatra, please be. Certificate is for Dr. Srikhetrta. Please come to stage. Dr. Srikhetrta. Dr. Smita Rani Behera. Dr. Smita Rani Behera. Dr. Priyabrat Kalikinkar Ojha sir. Dr. Nirmalya Chandan. Dr. Minerva. Tisri Jena. Dr. Itisri Jena. Dr. Kaushal Kumar Roy. Dr. Biswajit Sahu. Dr. Subhash Chandra Pujari. Dr. Manoranjan Das. Dr. Akanksha Rai. Dr. Nivedita Saman. Dr. Sabyasachi Jena. Dr. Priyaranjan Sahu. Dr. Bharti Samantra. Dr. Aditya. Dr. Minati Nayak. Dr. Sukari Kumar Maharana. Dr. Sagarika Parira. Dr. Mubaraka Rahmat. Dr. Mubaraka Rahmat.